I've seen a lot of people start talking about how the interview trail started for residency. You're going to get a lot of the same questions everywhere you interview. And I thought I would tell you some of the do's and don'ts that I've learned over the years that help you along the way. The most common question I think you hear is, why are you interested in our program? The don't answer is this. Honestly, your hospital cafeteria has a 4.5-star rating. And I saw on Instagram that you have call rooms with good pebble ice. Plus, this city has 5 breweries within walking distance, and my ex just moved to the other side of the country. So the vibes here just feel right. I was drawn to your program for 2 specific reasons. First, your resident at teacher curriculum. I'm passionate about medical education and was impressed by the protected workshops you offer. Second, I was excited by Dr. Smith's research on flash therapy. My third year research project was on a similar topic, and I see a clear path for mentorship and academic growth here. Tell me about a time you had a conflict. Oh, totally. So the senior resident told me to check a patient's potassium. I was going to, but then I got a text. Anyway, long story short, the patient's heart did a funny little dance and everyone started yelling at me. It was a super toxic environment. I ended up just reporting the resident for creating a hostile workplace. You have to stand up for yourself, you know? During my medicine clerkship, another student and I had different styles for presenting patients. I prefer to be concise, while he preferred to be extremely detailed. This made our team rounds run long. We talked about it privacy and agreed to use a standardized sign-out template for our shared patients. It made us both more efficient, and our resident complimented us on our teamwork. It taught me to find a shared process when styles clash. What is your biggest weakness? I'm so glad you asked that. I'd say my biggest weakness is probably my crippling inability to wake up to alarms. I'm just not a morning person or an afternoon person, really. Also, I get pretty nauseous around needles and sick people and paperwork, but I am a quick learner. In the past, I found that I could be overly independent with my work. For example, in a research project, I tried to troubleshoot a problem for hours before asking for help. I realized that this just isn't efficient, so I've been actively working on it by setting a 30-minute time limit for myself on new problems before I reach out to a colleague or a senior resident for guidance. So they're always going to ask you if you have any questions. Here are the do's and don'ts you should consider. I'm very passionate about work-life balance. So how many of the required rotations can I realistically do from home? What's the exact algorithm for who gets good parking spots? I'm willing to negotiate. Will the program pay for my streaming subscription? I consider Grey's Anatomy to be a core part of my ongoing medical education. Could you tell me the balance between resident autonomy and supervision, particularly as residents progress from PGY 1 or 2 to senior levels? What systems does the program have in place to support resident wellness and build camaraderie among the residents? I read that you recently launched a new wellness program. How do you see this new development impacting resident training and research opportunities over the next few years? So tell me about yourself. Okay, well, I was born at 3 a.m. on a Tuesday. I've always been a night owl, which I think is great for call, right? In the third grade, I won a spelling bee. It was the word synergy, which is funny because my cat is named Gizmo. Anyways, high school was a time. Then in college, I dated a bio major. Oh, wait, you mean for medicine, right? So I like science and helping people, and I really need a job. I'm a fourth year med student originally from the North. My interest in medicine was first sparked by a research project in college where I followed a team taking care of cancer patients. I went into medical school with an open mind, but my third year rotation in medicine, where I spent a lot of time on the oncology floor, really solidified my passion for taking care of cancer patients. I found I really thrive in developing long-term relationships with patients. That experience led me to pursue a research in patient outcomes. And now I'm looking for a program where I continue to build on that foundation and grow as a clinician. Where do you see yourself in 10 years? In 10 years, I'll be the chief wellness officer for the entire hospital system, which I'll have rebranded, of course. I'll be working 3 days a week from my yacht. I also have a best-selling book called The 4-Hour Intern and my own line of designer silk line scrubs. This residency is just a stepping stone for my personal brand. In 10 years, I see myself as a well-rounded physician in radiation oncology. I'm very interested in proton therapy, and I hope to have completed a fellowship and be practicing in an academic setting. My goal is to balance excellent clinical work with teaching residents and med students. I'd like to also be involved in clinical research and perhaps take on a leadership role, like serving as a clerkship director or a hospital quality improvement committee.